Do you have tension in your upper back, maybe towards your shoulders, tightness in your chest area going into the arms, and you're looking for an easy solution to help you get out of this tightness, pains and tension, then this is the video for you. In this video, I'm going to share with you 4 positions that you can do, and all you need is a tightly rolled up towel. Welcome to week 4 of the summer reset. In my last 3 videos, we focused on other parts of the body, the feet, the legs, moving into the core. We're now moving up into the upper body, and next week we'll get more into the arms as well. That is great for everybody. We all start to sort of slump forward and fall into the body. Our shoulders start to round forward, so we want to open up the chest here so that we can start to bring those shoulders back and down, start to release some of this tension in the upper body. So hello, my name is Catherine. I'm a block therapy instructor and fascia alignment coach, and I use block therapy's tools to help me when I feel any stiffness, tightness or pain, to be able to release those fascia restrictions out of the body. And I also support people with in-person and online classes and one-to-one support to be able to move with more ease and get rid of that tension and pain that they're experiencing as well. As with all the classes, we're going to start in the belly position. So if you need to know how to roll up your towel, there should be a link on my screen now from the week 1 video that I did showing you how to roll up that towel. You can do this on a bed, or you can do this on a mat, or you can do it sitting on a seat. If you're sitting on a seat, just place the towel where the belly button is, add some pressure with your hands and start to lean forward and connect to that diaphragmatic breathing, doing the same as I'll guide you as lying on the mat or on the bed. You can also do this lying on your back as well and just add pressure. So you want to come down to the mat or the bed, slowly lowering yourself roughly where the belly button area is, and stay up on your elbows if you can. You want to connect to that breath, so breathing in and out through the nose if you can, in for a count of 4, feeling that belly expand. You want to feel that belly lift onto the towel, and then exhaling for a count of 6, imagining that belly button's going to the back of the spine, really pulling that belly button in, and then even holding before you take your next breath. And just focus on that breath. We don't want to be hunched into the shoulders, we want to support the upper body. So if you're not able to do that with any tension you have here, you can come down completely and lie flat, or you can get some support cushions or pillows to support this upper body. We don't want to cause any tension to your neck or the shoulders in this position. Now we are searching for pain. You may feel pain already. That is due to inflammation, undigested food, waste that hasn't been eliminated. If you can't feel any pain, you may just need a little bit more time to sink deeper into the towel, or you can start to search just by turning the body slightly to either the left, adding some pressure more to the right, so you're dropping that right hip closer to the mat and twisting to the left. So make these movements nice and slow, and then you can do that the opposite way, dropping that left hip and twisting over towards the right. I want to stay in these positions for a minimum of 3 minutes, and then once you've done that, you place your hands under your shoulders and slowly exhale up and out of position. So the next position we're going to do is the sternum. Now we did do this in last week's video, but we want to do this again to start to open up that chest. So the towel, tightly roll it up again, will go in between the chest, roughly in this area, don't worry too much. And then you'll come to lying down, or if you're sitting in a seat, you can just add pressure and lean forward, putting your elbows onto your legs in a chair. So if you're on the mat, on the bed, just come down, slowly come on top of it, and then you can place your hands by the side, or you can lean them out to the side to really stretch and open up this sternum area. So when we start to fall forward, we start to collapse and we lose the space here. So this is a great position to do if you have any allergies, asthma, or any breathing difficulties, or when you've got a cold, so we can open up the chest. But when we collapse forward, we want to open that up so all the organs have the space that it needs and the blood and oxygen can flow. So we want to be breathing, as always, in and out through the nose. So in for a count of 4. So start that breath from the belly and then expand it all the way up to the chest, so where the towel is, and then exhale again. Imagine that belly button's coming to the back of the spine for a count of 6. And search again by just dropping the shoulder to the left, closer towards the mat. And you can twist again to the right and do the same, dropping the right shoulder and then twist again to the left. So just making these small movements and stay in this position for a minimum of 3 minutes. And then when you've done that, place your hands under your shoulders and slowly exhale up and out of position. Next position we're going to do is get into the pec, so tightly roll up that towel again, and if you get your right hand and place it in your armpit, where the thumb comes out is roughly where the towel is going to go. So the towel will be on its side and you'll be lying on your stomach with your arm out to the side or bent in like a diagonal. So place that hand in the armpit, see where that thumb is and just place the towel there, and then we'll lie down. Now if you don't want to lie on your stomach, you just want to sit in a C, again you can add pressure just by leaning forward and adding pressure with the hand and using your elbows to add some pressure. But if you can lie on a bed to do this, you'll get a little bit deeper. So come down to the mat or the bed, find roughly that area, don't worry too much, and then turn your head so you're facing the mat, so your hips are down, and then you can either keep your arms to your side, or if you stretch it out you'll get even deeper, and you can add some more pressure by coming onto the hand, so putting some extra pressure into the right hand and pulling over. And if you really stretch out those fingers and turn towards the right, you just open up that area to get even deeper and connect to that breath. So again, breathing in and out through the nose, in for a count of 4, and you'll feel your belly expand on the bed or the mat below you, and then exhale for a count of 6, feeling that belly. Imagine it's going to the back of the spine. And then once you've done that for 3 minutes, just exhale up. And then you can do the same on the other side. So next we want to get into the deltoid area, which is the side of the arm. So the most important part for this is the arm position. So the towel will be roughly like this and you'll be lying on your side. Now the arm is in line with the body here, and we want to make sure it's moved back so that we're not squashing that pec area. So we don't want it in front of the body, we want it parallel but just slightly behind. So as you're lying down, that's where the arm will be, slightly behind you. If you do come straight on or slightly forward, it just means you're compressing this pec area that we've just decompressed. So we want the arm to not be forward, not just straight in, just behind you as you're lying down. So come to a side lying position. Now if you want to do this in a seat, you'll need to use like a wall or something to lean on so that you can add pressure that way and lean on. But if you can do it in a bed, again, you might find it more comfortable. And then making sure that you're putting that arm further back. Now make sure you get some to support your head here, a pillow or cushion, so that you're not causing any strain to the neck. You can also dock that tongue, so placing the tongue at the top of the mouth. There's a ridge about 1 centimetre away from the top of the teeth. Suction it up, and that helps to support the head and the neck as well. And then you can just connect to that breath as we do, breathing in for a count of 4 and then out for a count of 6, and start to search by leaning into the front of the shoulder area. Very slow movements, you're connecting to pain. So remember, we're searching for the pain, and then we're connecting to that exhalation to breathe it out of the body. And then you can search more to the back. You make adjustments with your legs can be straight or bent. You can place a foot flat on the ground to search more behind, whatever you need to do to make yourself comfortable, but also searching for that pain in the area. And then once you've done that for 3 minutes, you will feel some pins and needles and numbness in the hand as well, which is all normal. You can exhale up and out of position, and then make sure that you do the same on the other side as well. And the final position I'm going to show you for this class is the forearm. So anywhere between the crease here to the wrist, you can place that towel, and we're going to do this on the side. But again, if you're doing it in a seat, you can use your upper body to support you, so by placing it anywhere here, adding the pressure and pulling in. And if you're able to go onto your elbow, and come down onto your elbow, make it like a triangle so the legs can be straight or bent. You've got that shoulder in alignment, the hands facing the feet, so you've got this little triangle. Getting your towel, placing it anywhere on the forearm, and then using your upper body to add that pressure. The more weight you put on it, the deeper you'll go, so you can always back off. And you want to connect to that pain again. So you can lean forward, you can make adjustments with your legs to add some pressure, and start to search for where that pain is. You can twist, add a little twist into it. So just searching wherever you need to be, connecting to that diaphragmatic breath at all times. And we can add some movement to the hand as well. So as you inhale, you can make a fist, and as you exhale, you can open up your hands. So inhale for a count of 4, and exhale for a count of 6. And staying in this position for a minimum of 3 minutes. We want to make sure we're not slumped in, we've got that shoulder back as well, and so supporting your upper body too. And then once you've done this for 3 minutes, you can exhale up. Again, you might feel some pins and needles, numbness in the hand. That's all normal, and as long as you can breathe in a relaxed way, it's okay to stay in that position. If you go to a position where you can't breathe in a relaxed way, just loosen the towel, ease off the pressure, or come out of position. So those 4 positions will help you to start opening up the chest, getting into those arms. Next week we're going to get more into the arms to cover more all the way down to the fingers. So if you have shoulder pain, this is all connected. Working the whole of the arm is important, because as it rotates forward, your arms internally start to rotate, and we need to, if we just loosen this is still locked out of alignment, so we need to be unraveling all of the tension, the twists and turns that the fascia has locked us out of alignment, so that we can bring our arms back and get rid of that tension and pressure that we're feeling inside our arms. If you enjoyed this session today, I have full hour classes where I stay in position with you, guiding you throughout each position. These are held online and in person. There's links in my description. I also have a membership if you can't attend live but want to get that community aspect, so that you can ask me questions about the positions that you're doing and supporting you to start to move with more ease. So thanks for watching, and I look forward to seeing you next week when we get into the arms.